Accidents happen. It's true that at some point we all get hurt. This is never a fun experience. But we can lessen the discomfort or pain by acting quickly and calmly to improve the injury or sickness. This is called first aid. The initial medical help given to ourselves or others after sudden injury or illness. There are a few key points to remember here. Firstly, whatever the situation, try and speak to an adult and get support as soon as you can. If no one is with you immediately, quickly report the injury or illness to a caregiver, and they'll make sure you get well. Secondly, in any accident or first aid situation, the most important person to keep safe is yourself. Don't act or help unless you are confident it is safe to do so. What are some common injuries that you can think of? Things like small cuts, minor burns or nosebleeds are pretty common and everyone experiences them at some point. There's some simple first aid steps to take for each. For cuts and grazes, we'll need to stop any bleeding and clean things up. Make sure you wash your hands first to avoid infection. Rinse the cut or graze under drinking quality running tap water. Pat the area dry with a clean towel. Next, put on a plaster to cover the wound. Burns and scalds are also really painful and usually caused by heat or hot water. It's important to cool the injured area as quickly as possible with cool or lukewarm water for 10 to 20 minutes. Make sure no clothing or wearables like watches are touching the area too.
Even if you do not lead an active lifestyle, you might sprain a joint at any point in time. As the ankle is the most commonly sprained joint of the body, let's look at how to render basic first aid to it. Treatment of sprains is simple. All you need to remember is a simple bowl of rice. Why rice? It stands for rest, ice, compression, and elevate. Rest the joint if you are in the middle of a workout. Stop putting pressure on the affected area. If you choose to ignore the sprain, you will risk permanent damage. Ice the affected area. Do this as soon as possible to help limit the swelling after an injury. Remember, do not apply ice directly onto your skin and try to wrap it with a towel first. Compress the affected area. A crepe bandage from your first aid kit will work very well for this. Elevate the joint. If possible, try to raise the affected area above your heart. This helps to prevent and limit swelling. This process can be done 4 to 8 times a day and up to 2 days after the injury. Do also note that you should only ice the sprained area for up to 20 minutes at a time. Get medical assistance if you experience any of the following. Develop redness or red streaks that spread out of the injured area, or if the area has been injured for several times before.
Whenever there is bleeding from the nose, we should sit or stand upright, and we should tilt our head forward. Tilting head forward prevents the blood from draining back. After that, we should apply pressure with the help of thumb and forefinger on the soft area which is underneath the nasal bone for 10 to 15 minutes. During this process, there may be difficulty in breathing, so we should breathe through our mouth. The pressure should be applied for 10 to 15 minutes. Usually, the bleeding stops. If the bleeding doesn't stop even after 15 minutes, the nearby doctor should be consulted. Head injury. The patient should be asked to rest, and a cold compress should be applied to the injury. If they become drowsy or vomit, then the emergency number should be dialed, or a nearby hospital should be approached.
Treatment of leg cramps. The affected muscle should be stretched and the stretch should be held for as long as is required. Gently massaging the affected muscles promotes blood flow and relieves the cramps. Sports massage is also helpful. Stretching and strengthening helps in preventing further episodes of cramps.
If someone thinks they're about to faint, help them to lie down immediately, as this will help to restore the blood flow to the brain. It's not advisable to just get them to sit down, as fainting while leaning forwards risks them falling and hurting themselves further. If you're indoors, ask someone to open a window, as fresh air may help them to recover. When someone has fainted, lay them on their back and raise their legs about 30 centimetres. Keep them supported by either resting their legs on your shoulders or by using a box or a bag or some other object to support them. This will improve the blood flow to their brain and normally they'll recover quite quickly.
In this health sketch, we want to talk to you about CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the centre of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimetres. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally.